Hello, I am Cheryl Douglas, the Michael E. DeBakey Veterans Affairs Medical Center Pharmacy Chief, where serving veterans is our first priority. Our residency program was established in 2005, and we are excited that you are considering advancing your pharmacy practice experiences with us. We invite you to a city where we have great food, great entertainment, great shopping, great sports, and oh yeah, great residency program opportunities.
Hello everyone, my name is Chandler Scheck-Snyder, and I'm the PGY1 Pharmacy Residency Program Director here at the Houston VA. I'm also a home-based primary care clinical pharmacist practitioner. Today you're going to learn more about our amazing programs here at the Houston VA for our residents, especially the ones for our pharmacy residents, that being our PGY1 pharmacy program, as well as PGY2s in ambulatory care, psychiatric pharmacy, and infectious diseases.
And my name is Maya Harden. I'm currently a PGY2 ambulatory care resident and the outgoing resident for this year. And a few things that future residents may be able to look forward to with the PGY1 program specifically are the wide variety of inpatient and outpatient rotations, varying from heart failure clinic to spinal cord injury to acute surgery. Also, residents can look forward to practicing under and learning under clinical pharmacy specialists who have a scope of practice and also prescriptive authority, therefore practicing at the top of their license. And lastly, we do have a wider variety and number of co-residents, being 5 for this year, with the PGY1 program allowing residents to bond and utilize their cohort effectively.
That was a great overview, Maya. And here are some more testimonials from some of our incoming and outgoing residents that will give you great insight into what we do here as we train our residents at the Houston VA.
Hi, my name is Abella. I am an incoming PGY1 resident from Atlanta, Georgia.
And my name is Mario, and I'm an outgoing PGY1 resident from here in Houston, Texas.
Hello everyone, my name is Raymond. I'm an incoming PGY1 resident at the Houston VA.
Hi everyone, my name is Samara, and now I am an outgoing PGY1 resident at the Houston VA.
Hi, my name is Catherine, and I'm an incoming PGY1 resident at the Houston VA.
Hello, my name is Oral, and I'm an outgoing PGY1 pharmacy resident here at the Houston VA.
Hi, my name is Miso. I'm an incoming PGY1 pharmacy resident here at the Houston VA.
Hi, my name is Laniria, and I'm an outgoing PGY1 pharmacy resident at the Houston VA.
Have you ever been to NASA? No, I actually haven't. I'm born and raised here, but I've never been.
I love NASA. It's definitely a cool place to go if you want to see some awesome space shuttles, so you should definitely check it out.
Have you ever been to the rodeo?
I have not. I'm from the city. We don't have rodeos there.
All right! So Houston is a pretty large city, but we have a really good rodeo. It's huge. There's a lot of food to try and a lot of different rides to attend, concerts. But aside from that, there's also a lot of food in Houston overall. Really worldwide, like, food and just available all over the place, and a lot of attractions, museums. So I'm excited for you to try all of those things.
I'm definitely excited about the food part. Definitely.
Have you ever been to the Astros game before?
No, I have not. I haven't been able to see the world champions.
Oh my gosh, they have so many fun things to do, like the peanuts thrown in everywhere. I'm sure you don't want a peanut thrown at you.
I don't want a peanut thrown at me.
But it's pretty good, and they also have canes there. Are you familiar with canes?
Yes,
Oh
I
my
got
gosh.
I gotta get the caniac there.
Yes, the cane sauce
Okay.
will do it. Yes, most definitely.
So, Lanaria, I'm actually from Dallas. What would you say is your favorite food here in Houston?
Wow, so my favorite food right now is sushi. I really love sushi, and there's a lot of cool spots downtown.
Okay.
And we actually have a sushi bar downstairs in the cafeteria.
Well, that's actually good to know because I love sushi myself, so having an option close by is definitely going to work out for me.
So why did you choose Houston VA?
I chose the Houston VA because of the robust experience that I would have just by going to mid-year and talking with the residents and the RPD, just the experiences that I'll have on clinical rotations. And in the VA, they have pharmacists have prescriptive authority, and that's something that every pharmacist would aspire to be able to have that help for patients without having to go through doctors and nurses, that pharmacists can really impact patient care. And this program has 5 residents, so I'm really not doing this alone, so I'm excited.
What's been your favorite memory here at the Houston VA?
Well, that's actually a good question. I would say most definitely my co-residents bonding, definitely going out, sushi nights. That was so much fun. And then as well as bonding together in the hospital, kind of collaborating when it came to creating a manuscript. We've never done that in our whole entire pharmacy career, but it was definitely something that we tackled together and we were able to accomplish it.
What is going to be the most important thing you're going to miss at the VA?
I think the most important thing I'm gonna miss at the VA is definitely my co-residents. We definitely were a family. We went through everything together, so I'm gonna miss them the most. And I'm also going to miss the veteran population as well, serving them. They've done a lot for us, and I definitely want to be able to serve them again sometime in the future.
What rotation are you most looking forward to next year?
So the rotation I'm looking forward to the most is actually mental health. I was able to complete a rotation as a P4 in the primary care mental health clinic. So I'm looking forward to exploring other areas of mental health that the VA offers.
That's great, and we have a lot of excellent mental health preceptors here too.
I look forward to it.
How has the Houston VA prepared you for even going outside?
I think the preceptors did a big part of that. They helped build my clinical knowledge and confidence in that. And if I didn't know an answer, I would know where to look things up. So I think that are some skills that I can take when I move to my next step.
I wanted to go to this VA because I had a rotation here.
Okay.
And here I was able to see how respected the pharmacists were by the whole healthcare team, especially doctors and nurses. And I felt like I would have a great learning environment here, with the supportive environment and the supportive RPD and my co-residents as well.
Yeah, and most definitely you will definitely get all of that support and all of that just motivation altogether and inspiration to be the best pharmacist that you can be. I can definitely say that I chose Michael E. DeBakey specifically in regards to my father being a veteran. And so just seeing him coming into this specific facility all the time when I was a little girl, it was something that I always witnessed with the pharmacy, especially the outpatient pharmacy, always giving the best care that they can give to my father, and that was something that was inspiring. So I knew I wanted to be here and pursue my my experiences here at this VA.
What are you looking forward to the most this year?
I think I'm looking forward to my growth and my learning because the VA has such great inpatient and outpatient rotations and experiences. I'm also looking forward to teaching the layered learning here. And overall, I just want to be able to grow and serve those who have served us.
So now that you're done with your residency, what would you say is your next step going forward?
So my next step actually is going to be to stay on. I'm going to be the new incoming PGY2 ambulatory care resident. And I'm so excited to stay here and learn from people that are very dedicated to their patients.
We'll see you.
We'll see you at the Houston
At the Houston
VA.